Welcome to the Alameda County Pod Training Module for the Operations section. As a member of the operations team at the Point of Dispensing site, you have the central role in making the pod successful. The operations section is the largest section in the pod because it's responsible for carrying out the main pod activity of dispensing. Most operations jobs involve face-to-face interactions with the public. The other sections are all working to support your mission. Planning does record keeping and situational analysis using patient and ICS forms after you're done with them. Logistics provides supplies and personnel. And finance keeps an audit trail and collects receipts and injury and damage reports. For purposes of the anthrax scenario, your mission is to dispense oral medications, that is pills, to an entire community within 48 hours. This is a time-critical emergency, so speed is essential. Remember, rule number one in a time-critical event is speed equals survival. This is why we practice for anthrax. Other scenarios, like pandemic influenza, may require different prophylactic medical countermeasures, like vaccine injections or nasal sprays, but may not be as time critical. However, in all cases, remember to keep the line moving. Although your primary mission is dispensing, the public may feel their primary mission is getting information. As a point of contact with the public, you will be the focus of many questions. There will be a massive public information campaign to assist you. But you should remember that the public is looking at you as a role model. If you display calmness and understanding in the emergency, the public will reflect it. Be prepared to address the most obvious concerns. For instance, the public may question why rush prophylaxis. They might worry about the risks. And they might wonder about effects on pregnancy. Limit your information to what's found on the fact sheets. And remember, only the Public Information Officer or designee with Emergency Operations Center clearance should communicate with the media. As part of the emergency response team, you'll be the first to receive prophylactic medical countermeasures. Once the pod is set up, its first mission is to treat the pod staff, including you. The dispensing group will take their medication. Then they'll dispense medications to the rest of the pod staff. This also allows the staff to give the pod process a dry run. The pod has two basic flow tracks, the express track and the assistance track. 95% of people will go through the express track and receive medications normally. The assistance track is only for the small percentage whose health would be threatened without special medical attention or communication. The dispensing process is meant to be fast and simple. Fill out a form. Review it for allergies or complications. Pick up medication. And turn in your form with name and medication listed together before exiting. And if you need assistance, there are medical and communication experts available to help. Pod operations can be divided in many ways. There are clinical and non-clinical roles, there are express and assistance tracks, and there are station staff and roving staff. Let's first review the operations roles for the express track, which will process 95% of clients. Initially, there's the arrival area. When the public arrives at a pod, this is the area where they first become our clients and come into contact with pod staff. Arrival extends from the pod entrance all the way into the parking lot. Staff covering the arrival area all the way to fill out forms includes greeters, flow control, information staff, and interpreters. Together, this team is responsible for making sure that the pod gets a steady stream of form-ready clients. Greeters are the first contact with the public. Greeter number 1 is stationed at the very end of the line. The greeter's mission is to form clients into a manageable line. be supportive to those with concerns, and be on the lookout for the severely ill or infirmed. This may involve walking up and down the line asking questions. Is anyone feeling ill? Or was anyone in direct contact with someone who was ill? If you encounter someone who's sick outside the pod, quickly separate them from the rest of the crowd. Don't send them into the pod, but get them to an outside medical team. You might also remind clients that cell phone use should be limited to emergency communications only. Don't overload the cell towers. After the greeters, clients move into the care of flow controllers. The flow control team is responsible for making sure that the line feeds quickly into the pod entrance and that forms are distributed. After flow control, clients move into the care of the information staff. The information team is responsible for making sure that the forms are filled out as fully and accurately as possible. Because the public sees greeters, flow controllers, and information staff as the first professional faces at a pod, your demeanor can have a big impact. If this is a dire emergency, one of your most important responsibilities is to remain a calm and reassuring presence. People may have a lot of questions. If there's time, calmly answer their questions, but only if you're certain you know the answer, and it will contribute to the flow. One technique is to keep moving yourself. If you stop to talk, the line stops to listen. Remember that there are printed materials and Q&A staff stationed at the exit to answer any questions that clients still have. Roving staff can be found anywhere in the pod, including arrivals, and may be able to assist you. They include interpreters, mental health workers, chaplains, and runners from the logistics unit. In large pods, clients will have to fill out forms while standing. Forms should be preset on clipboards with plenty of spare pens or pencils. The patient information sheets should remain with the client on the clipboard through all stations of the pod, and each form should be uniquely numbered for follow-up evaluation and disease surveillance. Staff will add information to the form as evaluation, care, and medicines are given. This decreases incidence of lost forms and charting errors. Patient information forms will vary depending on the incident. For anthrax, one person can pick up medication for others, so the forms allow for multi-person pickup. In contrast, for an injectable vaccine pod, only those who show up in person can receive treatment. The patient information form for anthrax is a sorting tool, formatted to quickly separate yes from no answers. It's divided into 2 steps. Step 1 sorts allergies to doxycycline, the most likely primary medicine, and identifies children and pregnant women. If there's a yes answer in Step 1 for anyone on the multi-person form, clients need to answer the questions in Step 2 for that person. As a flow controller, your job is to make sure that clients answer the questions. Don't diagnose them. Leave that for forms reviewers and the clinicians at dispensing and medical evaluation. The most you should offer, if the clinical group supervisor and pod site manager approve, is simple clarification of medications. Success for the fill out forms team means that the standby area at the entry to the next station is always packed with clients holding completed forms. The next area is the show forms area, staffed by the forms reviewers. As a forms reviewer, you stand at the crossroads of the pod. Your mission is to sort clients into express track or assistance track. Remember, the vast majority of clients should go through the express track. Often, the show form station becomes the rate-limiting step in pod operations. This means the line backs up at show forms, and the speed of the pod becomes dictated by this station. Try not to let this happen. The best pods operate with the pickup medicine station as the rate-limiting step, with the primary mission, dispensing, dictating the speed. Each incident will require a customized form. As a reviewer, you'll get a briefing and an instruction sheet for each new form. The form we're using here is the Alameda multi-person pickup form for anthrax. If all persons listed on the form answer no to all of the questions in step 1, then you direct the client to the pickup medicine station. If a client has a yes answer in step 1, then look at step 2. If the client answers no to all of the questions in step 2, then they also are directed to the pickup medicine station. If a client has a yes answer in step 1 and step 2, then they should be directed to medical evaluation. People may be tempted to choose yes answers unnecessarily, so quickly confirm the reason for a yes. A single confirmed yes in step 2 means immediate redirection to medical evaluation. If clients have communication, ambulatory, or sensory issues, in short, if they cannot communicate or cannot walk the length of the pod, then they should be directed to special needs. Use the assistance track sparingly. Each special case consumes extra time and resources. But use common sense. Not all people in wheelchairs are special needs cases. And just because someone speaks another language doesn't mean that they require translation services. Most clients will have a functional understanding of English that can be supplemented by printed materials in their native languages available at the exit. Some pods may even have multiple language forms, so even a Spanish-only client could answer no to all of the questions and then be safely directed to pick up medicine. The next station, pickup medicine, is where the central mission of the pod occurs. At the pickup medicine station, the dispensing unit leader works with the dispensing evaluation unit leader under the supervision of the clinical group supervisor. In smaller pods, these roles may be combined. Dispensing staff are responsible for reviewing and marking the patient information form and handing out the medicine or preparing medicine for quick and easy dispensing. In the anthrax pod, medicine comes in the form of pills or liquid and can be pre-bagged into different dosages, both adult and child, with child bags having oral syringes included. This makes the job of the medicine dispenser easier. All you need to do is hand over the correct bags. But it also means that medicine dispensers need to be accurate and working way ahead of the demand. In an injectable vaccine scenario, other pod stations work roughly the same except dispensing. For vaccines, medicine dispensers will need to be skilled at giving shots to both adults and children. Also, the dispensing staff will need to monitor medicine storage temperatures and may need to dose syringes from multi-dose bottles. Nasal vaccine spray is much easier. The nasal syringe is placed at the nasal opening. A firm pressure on the plunger sprays medicine into the mucous membrane area inside the nose. A clip stops the plunger at a half dose for one nostril. Remove the clip and spray the rest of the dose into the other nostril. The vaccine works by getting into the mucous membranes, so inhaling is unnecessary and causes a bad medicine taste in the mouth. However, nasal spray isn't recommended for everyone, so some clients will still need injections. There are two primary anthrax antibiotics for oral use, doxycycline and ciprofloxacin. If clients have answered no to all of the questions in step 1, then clients receive doxycycline. If clients had a yes answer in step 1, but all no answers in step 2, then they should receive ciprofloxacin. Medical dispensers should circle on the bottom of the form which antibiotic and what dosage is dispensed. For pediatric medications, clients may need additional instructions such as how to prepare medicine for children. A 10 cc children's oral syringe may also be given if available. To keep the express track moving fast, the assistance track is split off to the side into two service areas: medical evaluation and special needs. At medical evaluation, the unit leader is available to address any client issues surrounding medication dispensing. The staff will have varying clinical expertise to act as consultants and are under the direction of the clinical supervisor. The goal of medical evaluation is to allow every client to exit the pod with appropriate medicine in hand or with a prescription for the appropriate medicine. The clinical group supervisor should conduct a briefing and have a pod medical evaluation reference sheet from the health department. Clients have been referred to this station because they've answered yes to questions in both Step 1 and Step 2 of the patient information screening form. Your job here is to finalize the selection and dose of medicine for clients who are routed to your station by the screening process. Some medical evaluation cases can be resolved with the client returning to the pickup medicine station to receive medication along with the rest of the express track clients. Severe allergy concerns are given prescriptions and referred to personal doctors for follow-up. If you're a medical consultant at this station and do not feel comfortable making this decision, please contact the clinical group supervisor for advice. Clients with mobility, communication, or sensory impairment should be sent over to special needs. Sick patients will be evacuated to healthcare facilities, as will anyone with life-threatening emergencies. The final station in the assistance track is the special needs area, a one-stop catch-all for any remaining problems that might disrupt flow. Your mission is to assist clients to complete the patient information form, provide medicine to them, and clarify instructions on using it if necessary. Some special needs cases simply need a place to sit and rest because they're too old or infirm to walk the length of the pod. Some special needs cases may need a language interpreter, and some may require mental health support. Since special needs is generally considered the home base for most roving pod staff, like language interpreters and mental health counselors, they should be easy to find. The last station for either the express track or the assistance track is turn-in forms. The turn-in form station is a collecting point for all patient information forms, but it also serves as a question and answer station. Staffing this station are the forms collector and the Q&A staff. The station itself should be arranged so that forms can easily be collected and printed materials grabbed on the way out, but Q&A should be off to the side or outside the building so that it doesn't impede the exit path. Forms collectors should remember that patient forms are considered confidential and must be kept secure. Once collected, patient forms still have work to do. They need to be collected by the planning section for use in monitoring pod function. Later, patient information should be computerized at a data input station. However, the written records must be maintained. Data entry of patient forms is not recommended during active time-critical pod operations. However, data entry should be performed within a few days of medication distribution because disease surveillance and tracking of medications or side effects will be important. If data entry is begun at the pod site, it's recommended that you do it after its use in analysis by the planning section. The last area in the pod the public encounters is the question and answer area. Q&A staff should help draw people out of the pod and be ready to answer the most common questions. Anything they cannot answer or address by handing out printed material, they should refer to personal physicians or online resources. Examples of questions you might hear at Q&A include: are there special instructions for taking Doxy or Cipro? The answer, most importantly, as with all antibiotics, continue taking the medication for the full number of days according to the schedule you were given, even if you begin to feel better. Or, what side effects are serious enough that I should go to a doctor? The answer, any side effect that forces you not to take your medicine is serious enough for you to consult or visit your doctor. Once clients pass Q&A, they're essentially finished with the pod. As a member of the pod operations staff, you're the tip of the spear in emergency mass prophylaxis. Your success can be measured in lives saved. The knowledge you gained here can be adapted to many emergency situations. Even if you're not deployed in an anthrax scenario, you should be better able to integrate your skills for the benefit of others. Thank you for becoming a public health first responder. This pod video training series is brought to you by the Alameda County Public Health Department, Office of Public Health Emergency Preparedness, in collaboration with Applied Creative Training, Inc.